This
Or at
conference will now be recorded.
4 o'clock. Can you hear me? I don't think this is on.
No, I think it's on, but
You won't have to worry about that. I'll talk about that. Yeah, I'm getting recorded. I'm gonna shut this door. First of all, the disclaimer for my presentation is, I want you to sit and listen and learn. I've been in presentations my whole life, and the first thing I do when I get a handout, I look at the back, I see how many slides there are, and throughout the presentation, I'm counting down. Only halfway through, 3/4 of the way through, and I don't want you to do that. The full presentation will be made available to you. And I'm going to tell you, there are some slides on that presentation. See if you need me to have this on in order for you to, he's recording it. But I don't think it's going to.
I bet she's getting you around there.
Yeah, maybe so. Anyway, there are some slides in here that are very, very important. But I also think it's important. You got it? Okay.
That's not the mic.
Okay, I'm getting that out of here.
It's up here.
Okay. There are some really important things I want you to know. And I also want you to listen to the big picture. You can always go back to the slides. I don't want you to be writing some of this stuff down, because by listening to it, when you go back to it, it's all going to come together. Trust me. And my disclaimer is we will get out early. It's always nice to know that too. So you don't have to cut down your slides, and you're going to get out early. And you always are in good favor with everybody when you tell them in advance you think they're going to get out early. But I don't want to shortchange this experience. Why? Because I know what you need to know. I've been a nursing home administrator, Gads, let me think now, for 30 years. Is that right? Let me think. 90, yeah, over 30 years. And it was a second career for me. I got my college degree, I got a job, I quit work, and I had 3 children. And I thought, what do I want to be when I grow up? And I thought, I really want to work in long-term care. I'll tell you more about that later. So I've been in your shoes. I know what this is, and I know how important it is. And I really feel privileged that I get to be here and talk to you about this. And hopefully at the end of this presentation, you're going to realize I am so glad I'm in this class, and this is the profession for me. So I'm Mary Brinkley. I'm the Executive Director of Leading Age Oklahoma. It's a trade association that represents providers across the continuum of care: nursing homes, assisted living, PACE, adult day, low-income senior housing, market rate housing. So it's the big picture. It's the seamless continuum of care. And our providers all work together. I mean, it's really great because someone starts out an adult day, they might transition to assisted living, and they end up in a nursing home. But the other thing is we can advocate for the long-term care profession, because none of us are well served if we only pay attention to one sector. Years ago, we only had nursing homes. I actually was a part of the development of the rules for assisted living. And so everyone said, we're not going to get assisted living in Oklahoma. That's terrible. Hell will freeze over before we're going to allow assisted living in Oklahoma. But now we can see how it's really good that we have options. We have different care levels. But there will always be a need for nursing homes. Always. That's without a doubt. And the good thing is, while you get your license and you'll be a licensed nursing home administrator, there are so many things you can do with that license. But one thing I will tell you, you need to be a nursing home administrator, because no matter what you do, if you don't have that experience, it will never give you the insights to the profession that you need. And I'll tell you more about my experience as a nursing home administrator as we go through this presentation. So in the future, there's going to be 2 types of facilities: the excellent and the non-existent. The former president of our National Association, Leading Age, always said that. But now, since we're in the midst of COVID, it has a whole different meaning. And I'm going to tell you, throughout COVID, I mean, we've been in the storm. The first 3.5 or 4 months of COVID, I worked 7 days a week, 10 to 12 hours a day, keeping up with all the regulations, changes, everything. And I would push that information out to all of our members, because administrators were trying to run a building. They didn't have time to keep up with all of this. So it's been a real partnership in this whole process. Everybody has had to pull together to get down the road in this journey of COVID. Hopefully, we're kind of seeing a light at the end of the tunnel. They're saying by the end of February, early March, we're going to move from a pandemic to an endemic. So what does that mean for you? Lots of things. Some of these nursing home administrators said, we don't want to leave in the midst of the storm. We don't want people to think, I quit right when it was getting tough. They'll get through it. But some of them are saying, and we do have an older population of administrators. Some of them said, I'll get through this, but then I'm going to retire. So there is probably no job right now that you could have more job security than in nursing home administration. There will be positions available. But the key is, if you're a good administrator, there's going to be lots of positions available. If you're a great administrator, you can write your ticket. And this program today on the ethics of long-term care is going to guide you through that whole process. Not how you can just get licensed, not just how you can be a good administrator, but how you can be a great administrator. So the requirement for this job, sure, you have to have your license. You have to have a 4-year degree. But I'm going to tell you, your heart, your passion, and your commitment will determine your success. Because if you just are doing this to get a paycheck, you think it's, oh my gosh, there'll always be a job. There are probably easier, quicker, better ways to get a paycheck. But if you want a rewarding job, a true profession, this would be the place you need to be. I always said that when I was a nursing home administrator, it was the hardest job I ever had. But in the same breath, I will tell you, it was the most rewarding job I ever had in my life. And while I help administrators now, help providers, when you are that administrator and have that staff and those residents, it is a fulfilling, rewarding job. So a little bit about me. I'm going to tell you lots of stories. I pulled this up and I'm going to tell you this. People will forget what you said. People will forget what you did, but people will never forget how you made them feel. And really, that's what I want to do with you all today. I don't want you just to understand what this role of an administrator is. I want you to feel what the role of this administrator is going to be, because it's your heart and passion that are going to determine your success. So what's going to help you is to learn by example. I tell lots of stories. By the end of this, you're going to know a lot of my family. You're going to know a lot of crazy stories that happened when I was an administrator. But it's going to help you remember those things also. So I tell it with stories, and I think it's important you know this path. So how did I decide to become a nursing home administrator? Some people, nursing homes have been in their families for generations. Some of you in this room probably have a parent or a grandparent that has had a nursing home, and that's your chosen path. Others, I don't know how you ended up here. Z. Thomas has a nursing home administrator. He was in the Air Force, and I never knew really what brought him to long-term care. But I'll tell you what brought me. So on my mother's side, there were 11 children, and my grandfather started to decline, and he needed to go to the nursing home. Back then, you start to decline, you went to the nursing home. So with these 11 children, they all got together and they said, okay, there's 11 of us. Every day, someone's going to have to check on dad. And there's 11 of us. So every 11 days, we're going to rotate. You have to be at the nursing home. So the first time my mom went, I went with her. And I walked in there. And keep in mind, this was back in the 70s, early 70s. And people were yelling and screaming, and it was a different world than it is right now. And we went to see my grandfather, and I wandered out, and people were saying, I need a drink of water. I need this. I was going in and out of these rooms helping them. I was like, oh my gosh, I'll help you. And then when we left there, I asked my mom, when do we get to come back? And she said, what do you mean? When do we get to come back? And I said, I liked that. I liked, helping those people. And she said, well, we're coming back in 10 more days. So I said, well, I'll come with you. And so I did the same thing. I wandered out of the room and helped people. And when we left there, I told my mom, I said, I think I know what I want to be when I grow up. And she said, what? I said, I just want to work in a nursing home. And she said, oh, heaven forbid. But then she got a great idea. From then on, she dropped me off at the door and she went shopping. She'd leave me there for 2 hours, an hour and a half, whatever. Then she'd come back and pick me up, say hi to her dad, and we would leave. And we did that until my grandfather died. And then I went to college, got a degree, got a job, did the thing with my kid, until all my kids got in school, I stayed at home. Then I thought, what do I want to be when I grow up? And I thought, I want to work in a nursing home. So I went to Administrators University, just like you're doing now. And then I'll tell you more about that journey as we get through this. So you're going to be able to pass your test. You're going to get through this class. We're going to help you. And then after you pass that test, you're going to get a job. And I'm going to tell you there's going to be jobs available. And the other thing I'm going to tell you, if you've done a great job and you really have a heart, send me your resume. I will help you get a job. I help people get jobs all the time. Although there was a guy one time that sent me his resume, and in the past 3 years, he had worked at 7 different places. It really wasn't even a full 3 years. So I put that one aside. That one wasn't worth passing on. So you do a good job. I've helped lots of people find a good fit if they're looking for a job in long-term care. So what we're going to go through today is the good, the bad, and the reality. And I get to talking and I forget to click the slides. I tell my stories. So if I ever forget, just raise your hand and say, advance. So this is an essential profession, an essential role. So when COVID hit, how many of you saw those signs in front of nursing homes? Heroes work here, essential workers, essential caregivers. The sad thing is that should have been going on all day, every day, pre-COVID, because every day nurse aides and administrators go to work in the most regulated environment in the United States. Previously, it was nuclear power was the most regulated. Now it's nursing homes. So I really think we should celebrate everyone that works in long-term care every day, all day. So what has happened during COVID has really changed the face of long-term care. And moving forward, it's going to change the face. So what's happened? There's been over 1 million positive resident cases since COVID hit. There's been 902,964 positive staff cases. These are all CMS numbers. And by the way, we just hit over 1 million, I think yesterday or day before. So when people talk about the impact of COVID in nursing homes, it's not just the residents, it's the staff. I mean, how many days have the staff been out of the building because they were COVID positive? They had to be quarantined, all of these different things. So COVID's had a tremendous impact on nursing homes. In the next presentation, I'm going to talk to you about advocacy. That's all about funding. That's all about getting the legislature to fund our systems. And I'm going to tell you how important it is that there is a correction to long-term care post-COVID. Initially, 40% of all cases were in nursing homes. So everybody was attacking nursing homes. They don't have good infection control. They don't have this. Well, before long, and then it ended up now, 23% of the cases were in nursing homes. Why? It really wasn't just infection control. We know now that the elderly population are a more vulnerable population. So that's why there were more deaths, more cases and things like that. It wasn't all the nursing homes and our infection control procedures and things like that. But at the end of the day, so far, 10% of the nursing home residents have died of COVID. That's huge to think that the impact. And then we've had some staff die too, and I didn't put that number in here, trying to think what that number was. But we've had staff die. I mean, there was a dietary manager at one of my member communities. She had a little girl at 3 years old. She got COVID, she died. Truly unfortunate. I had a staff member, my director of clinical and regulatory services died of COVID. So currently in Oklahoma, 85.6% of all residents are vaccinated and 68.9% of all staff are vaccinated. I'm not going to I sure won't get into the politics of any of that. And I will tell you, no matter what, I remain neutral. I'm not a Democrat or Republican. I remain neutral. I just want people in nursing homes to be taken care of, and I want to protect this profession. But it's real important that you understand this vaccination rate. Everyone knows now that there is a mandate in place. That did stick. But there are exemptions, religious and medical. If you want some more information about that, we can talk about that during the break or something like that. But I think most facilities know how to address that with the exemptions, and we're all moving forward. But we have some testimonials nationally through organizations that early on required all their staff be vaccinated. Good Samaritan Homes, the largest not-for-profit in the United States, the third largest, I think, number of total beds nationally. They came out of the gate and required that, and everyone was like, whoa, why are you doing that? How can you do that? In doing that, their cases just really dropped dramatically and have stayed low. Right now, there isn't a vaccine mandate in assisted livings, and we're seeing a real uptick of cases in assisted living. They don't have a vaccine mandate for their staff, so they're really thinking, sure, some of it's tied to visitation, but there's also that continual exposure through caregiving to the staff, and they're thinking that that might have effect. I don't know everything. All I know is I want this to end. The cost of COVID has been off the chart. Nursing homes had a hard time before COVID with the testing PPE and the loss of staff, turnover of staff days away from work. It's killing us financially. So whatever we can do to address this and get out of this pandemic, the sooner we do it, the better off we're going to be financially. So that's all I'll say about that. So licensed nursing home administrators. This is a broad umbrella. You will have a responsibility as a caregiver. You're going to have a responsibility to your employees, and you are going to have a responsibility to the greater community. So you're saying, how will I be responsible as a caregiver? The day you put your license on that wall, you assume responsibility for all of those residents. So you become a caregiver because you have to make sure that your LPN and your nurse aides are there to deliver that care, to chart it, and do what needs to be done. So really, you are a caregiver. You have to make sure that that care is given. Responsibility as an employer. Every once in a while, I'll stop and say, remember this, it's a good one, a good nugget. When I took over a decertified nursing home as my first job, I was like, oh my gosh, what are we going to do here? I'm going to tell you, there's a big load that's on your back. You have to know about finance. You have to know about legal. You have to know about personnel, human resources, and regulatory. There's a lot you need to know. The more you can empower every single person on your staff, the better your organization is going to operate. If you think you can do it all on your own, you're going to have a long, hard journey. The more you empower all the people around you, that's how you're going to move to have a successful model. The responsibility to the members of the community. You're thinking, well, what does that have to do with me? I'm running a business. It has everything to do. Why? Because that's your next referral. That's your next resident. Those family members, excuse me. Those family members live in your community. So you want to have a good relationship, good outreach. And the other thing, your next employee lives in that community. So you want to be able to attract good employees, good staff to your organization. So you want a good reputation in that greater community. So here's a little story, true story. I was in the checkout line at Walmart one day, and there was a girl behind me with a t-shirt on that had the name of a nursing home. So I turned around and looked to her, and I said, oh, is that where you work? Yeah, it's where I work. I just got off work. Of course, we work short again today. There weren't enough people to take care of the residents. Nobody got their baths. And she proceeded to tell me every single thing that might have gone wrong, or maybe it even didn't even go wrong, but she was on a tangent and told me everything bad about that nursing home. And I was a complete stranger in the checkout line at Walmart. I was like, whoa, had a bad day. True story. Not 2 weeks later, I was in another checkout line someplace. Here's an individual with a t-shirt on from a nursing home. And I thought, I got to do it. I said, oh, I see your t-shirt from the nursing home. Do you work there? She goes, yeah. She said, today's my day off. She said, I just love my little residents. She said, Mrs. So-and-so's been sick. I even went by on my day off to check on her. I was been so worried about her. And you know what? She told me that she loves her job, that she takes good care of those people, and that that's a good place, that they have people like her. She goes, yeah, we all get together and we check on, like when I'm gone, this other person, she named him, they'll check on Mrs. Jones. Which nursing home are you going to go to? Which one do you want to work at? So you know what? Image and is everything. Because you know what? You want to retain those nurse aides. So the more they come in and they're a part of your mission, vision, and values, the better off you're going to be. And we'll talk about turnover more. So a long-term care administrator survey, and if Z is listening, I need an update on this survey. But the last time I don't think they did the full survey. They did a part of it, but the numbers were almost identical, very close. So there was a survey done in 2018. 13% indicated that they would be an administrator for at least 5+ years. The reason for leaving, threat of litigation. The reason for staying, the concern for the residents. 36% indicated that they would be an administrator for at least 10 more years. So look at that. I mean, we have an older, and Z has some numbers if anyone's interested in this, about the age demographics of this population. We definitely have a lot of 50, 60, and 70-year-old nursing home administrators. Right now, 3 out of 4 administrators have a 4-year degree since the change was implemented in 2001. So when I got licensed back in 1991, there were 1,500 nursing home administrators, and now I think we have right at 700. We also had 454 nursing homes, and right now we have about 302, so that's changed. So I have a question, and it's not a loaded question. I just really I'd like to know, no ulterior motives at all. So every one of you has a college degree. If the college degree requirement was not there, if you didn't have to have a college degree, if it wasn't required, would you still come to be a nursing home administrator? Would you be here if you didn't need a college degree?
I've been here 2 years ago.
You're getting your college degree. Okay. Sometimes people say, I wouldn't be here. If people don't need to have a college degree, and there's people in there not doing that, that don't have a college degree, why would I do it with my degree? Would it mean anything? So that's why I always like to ask that question. You know, would you be here? Would this be your career choice for your degree if it wasn't required? So long-term care administration in Oklahoma, you used to have a high school diploma. And we had individuals that, I knew a guy that started out in housekeeping. Then he went to maintenance supervisor. Then he went to the office, and then he became a nursing home administrator. You've probably heard of that, the people that worked up through the ranks. I always like to share this one person that worked up through the ranks. She started out as a nurse aide in high school, worked up through the ranks. She ended up becoming the governor of the state of Oklahoma, Mary Fallon. She was a nursing assistant. So I always love to share that. So that's the career ladder within the facility. And then there was a college degree requirement. And I'm really amazed at some of the people that are attracted to the long-term care profession now. We have people that come with a master's in public health administration and degrees and in everything. And someone said, so the degree is required. So if it's required, why isn't it specific? And I said, well, it really doesn't matter what the degree is in. You could probably tell me any area that your degree's in, and I could relate it to long-term care. If you're a teacher, you have to be a good leader. You have to teach those around you. You know, I could go on and on about that. Finance, HR, anything. But the main thing about your degree is you know how to learn, you know how to discern, and you know how to apply. And that's what this is about. You're going to get the regulations, you have to learn them, you have to apply them and discern what's most important. The AIT program, when I was decided to go through Administrators University, there wasn't an AIT program required. And I only had been in a nursing home when I went to go see my grandfather. I knew nothing. And there's people in this room that probably have never worked in a nursing home and maybe have only been in them a few times. There's also people in this room probably that you grew up in the nursing home. Your families have been connected to it for years and you know all about it. Well, I was in a class and I knew nothing about nursing homes except when I went to go visit my grandfather. And I was so intimidated by those individuals that had grown up in a nursing home. I thought, well, they know so much more than I do. So I went to a nursing home and I asked the administrator, could I come here every Friday and just shadow you or just be here? And she said, why in the world would you want to do that? And I said, so I could learn. And she said, that's ridiculous. But she said, I don't care if you want to do it. So I went there every Friday and had my own AIT program. I learned so much from that program. And here's one of those other nuggets. Find a good preceptor and find a good facility that you want to use for your AIT program. And if it's not working, if someone's saying you don't even have to come in, you don't hear me say this. I'll sign off on you. Find another one because you will learn as much in that program as you do in this class. You're going to learn by seeing and doing. You're going to, you might be at one facility and you're going to say, that's not the way to do it. That's not right. Maybe they're cutting corners. And if you want, you can switch. You can move to someone else if you want. I've had people switch and say, oh my gosh, the light came on. I learned so much. Or they started out in the right place and said, oh, this was the best experience. So don't shortchange that AIT experience. And then you're going to have Administrators University. There's some of these presentations that you're going to listen to and you're going to think, oh my gosh, why do I have to know all of this? I think they used to have 3 days at the MDS. And they've really cut that back because you have an MDS coordinator. You need to know enough to be dangerous. You need to know that they're doing it. They know the deadlines and they're updating it. You don't need to know how to code everything. So remember, your pack's going to be heavy. Learn what you need to know, and you're going to rely on the other people for the rest. When you get out and get licensed, you will have to have 24 hours of CEU credits every year. And you're thinking, oh my gosh, I have to do that. That's going to be the thing that's going to recharge your batteries, or it's going to give you what you need in order to be successful. I know that there's some people that will go online and they'll take advantage of free CEUs or unrelated CEUs that are, I say unrelated, it's a real stretch to see how that would apply. Let those CEUs drive your continuing education, your professional development, because the more you know, the better you're going to do. So don't shortchange that. Seek out programs that are going to help you and help your professional career. So the public's perception of long-term care. AARP did a study several years ago about nursing home facilities. 40% of the people that responded to that survey said that they would rather die than go to a nursing home. So what does that say about a critical service that everyone really, really needs? So now I'm going to tell you about my other grandfather on the other side. 10 children in his family. So run the numbers. I have this humongous family. Anyway, my grandmother was his caregiver, and she started to fail, and she died. And that happens often, that the caregiver predeceases the person they're caring for. So they had a family meeting, came in and said, we don't want to send Dad to the nursing home. We're going to let him stay in this house. His car's outside. We're going to hire 2 people, one 24/7, 5 days a week, one 24/7, 2 days a week. And it's going to be the perfect environment for him to age in. Well, the caregiver would be doing the laundry, cooking in the kitchen, doing things. And my grandfather was a real people person. And he was lonely. So one day he lives on kind of a state highway and he has a big picture window in his living room. was snow on the ground. And the caregiver came in and said, lunch is ready. She couldn't find my grandfather, looked all over the house, looked out the big picture window, and he was stark naked in the front yard, in the snow, waving to everybody as they were going by. So they called the family in. They said, okay, we're just going to threaten him. You do that again, you're going to go to the nursing home. So they told them, and you better not do that again. You better act right. A few days later, snow still on the ground. Caregiver can't find my grandfather, looks out the picture window, stark naked, waving at the cars again. Family comes in and said, we're going to send him to the nursing home. We're going to send him for respite. Send him on a Friday. We'll pick him up Sunday night. We're going to threaten him. If he doesn't shape up, he's going to have to stay there the rest of his life. So here's what happened. My grandfather, this people person, goes to the nursing home on Friday. And he's in the dining room talking to everybody. This is before you had to be a feeding assistant. He was helping feed people. He was greeting people at the door. He was in and out of everybody's room, making new friends. You would have thought he was the activity director or social services director. And so on Sunday night, they came to pick him up, and he said, I'm not leaving. I'm not leaving. And they were all stunned. But you know what that weekend did for him? It gave him his life back again. He was dying inside. He sat in that house with the caregiver doing laundry and cooking. And so what happened? That nursing home became his life, his family. He lived at that nursing home for 2.5 years. And when he died at the funeral, his children weren't on the front pews in the church. It was his caregivers. They were all right there on the front row because they were the ones that cared for him and did so much for him the rest of his life. So there is a real need for nursing homes, but the difficult path for all of us is we have to educate the public about the role of long-term care. If they've never needed long-term care for a family member, it's an unknown commodity and you can't value what you don't know. But I think through COVID, I was hopefully optimistic that this would help change people's opinions of long-term care. Unfortunately, some people are saying, well, they just spread the COVID in the nursing homes. No one, and so we still have some work to do. But I think people are kind of understanding now that the staff in long-term care truly are heroes, that it is a tough job, and it really is a hard environment when you have that many fragile people in a close environment. So we fulfill a great need, and people find out about that when they access it. We're an invaluable resource, and we do provide that great life enrichment that people really need. One time I was talking to an administrator, and he said something about a nursing home. He said, well, yeah, people just go there to die. I said, no, they don't. He goes, yeah, they do. People come to our nursing home, but they go there to die. And I said, no, they don't. I said, they come there to live the rest of their life. If they were coming there to die, they might as well just stay in their own home, not have anything to eat or drink, and die. They don't come there to die. They come there to live the rest of their life. And one of the things you always need to remember is we need to give them a life worth living. And I promise you, a lot of those residents in the nursing homes, they would probably forego their bath or nursing care to have socialization and activities. They want someone to talk to them. They want quality of life. But that quality of life doesn't always come through the nursing services. I had a friend that was in a nursing home. She lived in my hometown. Her sister was her caregiver, and her sister died. So the attorney that was in charge of her then moved her to another town where she knew nobody. If they would have kept her at least in that nursing home in that town, she would have known some people from her church and everywhere. So anyway, I went over to the nursing home to visit her. First of all, here's a nugget. I walked in there and I said, I told the receptionist, I said, could I speak to the administrator? And I asked, called him by name. She said, okay, come this way. Took me back to another room. And I said, oh, I'm here to see the administrator. Oh yeah, you check in here and I'll take you back there. And then there was his secretary assistant. I said, well, I need to see so-and-so. Okay, I'll take you to his office. So I had been through this maze and his office was in the very back. And I said, oh, hi, I knew him. And I said, I'm here to see so-and-so, also Susie. And I said, how's she doing? I don't know who she is. I said, well, she's been here years. He goes, I only know these people by my senses. I don't have time to get out there on the floor and know what's going on. He didn't even know anything about her. And he'd been there for years. She'd been there for years. And I thought, okay, it's important to know your residents. I'll tell you more about that in a second. So anyway, I thought, okay, know what kind of administrator he is. His office is in the back and he doesn't want to know what's going on in the front. Trust me, you always want to know what's going on in the front because you don't want to have a surprise. So I go in Susie's room and I said, hi. She had some dementia and a little bit of dementia, but she didn't really remember me. And she looked up at me and she said, what day is it? I said, well, today's Friday. She said, well, I was hoping it was Saturday. And I said, why? She said, that's the day I get a visitor. You know, she had no family, no one in this community that even knew her. She said, that's the day I get an assigned visitor, someone to come and talk to me. And she said, sometimes I'll get someone really good that'll spend 10 or 15 minutes with me and ask me what I used to do in life. She said, they always ask the same questions. But she said, other times the volunteer will come in and say, are you doing okay? And I say, yeah. And then they walk out. That was her personal contact the whole week. That was it. So, you know, when they come and say, we'll give you a bath and we'll help you with this. If she had her choice, she would have said, bring me someone to talk to me. You know, let someone work a puzzle with me or something because she was so lonely inside. I'm going to go back to another little nugget. When I mentioned about knowing what's going on, whenever I went to work as an administrator, we had the regular shift, 7 to 3, 3 to 11, 11 to 7. I always got there before 6:30. Why? I wanted to know what went on that night shift. So I was there for the stand-up report. What happened? Did anyone fall? Anyone have to go to the hospital? Anybody die? I needed to know that. I sure didn't want a family member calling me at 1 o'clock in the afternoon and saying, I'm calling about Mrs. Jones. And I said, well, let me go check on her, see how she's doing. And she died the night before. So I always did that. And then I would be there from 3 to 11. And then when the 7 to 3, I'd be there for 7 to 3. And then when the 3 to 11 shift would come on, I would be there for that. So I kind of know what was going on, which is really important. Here's another little nugget. My favorite friend was my legal pad on the corner of my desk. Anytime a family member or anything happened, or someone said, "Hey, the call light's not working in this room," I'd write it down. Anytime, you know how you're walking through the hallway and someone says, "Oh, by the way, we're getting close to being out of something," and you're like, "Oh yeah," and then 5 more people stop you and you forget to do it. I kept that legal pad. If you saw me, I had my legal pad with me. And when any issue was completely resolved, I marked through it. So sometimes I'd be flipping the page and I didn't tear off the page until it was all marked off. And then I dated it because I would know when it was taken care of. And you're like, well, that kind of sounds like overkill. That would have eliminated 2 IJs for a nursing home. What happened? There was a woman whose mother was in the nursing home, and she went to the nurse aide and said, my mom is just a little uncomfortable at bathing time. She gets nervous. The water is like cold or hot or something. Could you take a little bit more time with her because she's really scared at bath time. She doesn't want her bath. The nurse aide said, no problem. Days, weeks went by, nothing changed. So that family member, very nice, went to the charge nurse and said, I said something to the nurse aide about the bath, but they're really rushing my mom. Charge nurse said, no problem, nothing. No one wrote it down. No one addressed it. Nothing changed. The family member remembered it. So nothing changed. She went to the DON and said, we've got a problem. I talked to the nurse aide, talked to the charge nurse. My mom is really getting uncomfortable. It's really upsetting her about bath time. The DON said, oh, we're here to take care of your mother. We'll handle that. Nothing changed. Family member goes in and talks to the administrator and says, this is a problem. And administrator, I'm on it. I'm going to make sure. I'm going to find out why no one followed up. And you know what? He didn't follow up either. So the family member wrote a letter, copied the administrator, and sent it to the health department and said, I contacted the nurse aide, I contacted the charge nurse, the DON, the administrator. This months have gone by, nobody's changing anything. I just want my mom to be cared for. The mother wasn't abused. Well, it might have been maybe a little slight abuse, maybe like it was, she's being rushed, maybe it was, but it really wasn't abuse. Neglect, maybe, that they weren't really paying attention to her needs. But anyway, you know what happened? The health department comes out and cites 2 IJs, going back to the date that that woman first complained to the nurse aide. So the little legal pad, anytime something comes up, write it down. When it's resolved, tell the family member, I talked to the nurse aide about that. We got that taken care of. Thank you. I will tell you, there are communities that have never had a lawsuit, but they also have very, very good family relations. Because you know what? That's where your lawsuits come from. And if families know that you're going to listen to them, that your concerns are important, and you're going to help resolve them, there won't be as much exposure for lawsuits. Building safety into process of care is a more effective way to reduce errors. The focus must shift from blaming individuals for past errors to preventing future errors. And you're thinking, what in the world does this have to do with us in long-term care? You know what? I walked into a nursing home one time and walked in and there's like a living room. And I'll tell you, when I'm going through Oklahoma, I stop in the nursing homes. I've been in nursing homes all over Oklahoma. I love to see what's going on and just learn better ways to do things and stuff. But anyway, when I walked into this nursing home, the DON and the administrator were just screaming. They had brought all the staff out there and they were screaming at them for something that happened. And I was like, wow, bad timing. The administrator caught my eye. I caught her eye and she was like, oh, Mary, come back here. She took me back to her office and we got out of there. But all I could think of is how useless that was, that process that they were going through with all these people out there. You know what? You can blame people all you want for an error, but what we have to do is fix errors. In nursing homes, there are so many touches, so many ways something could go wrong. But it's how we handle it. We don't blame someone else, we work together. We're only as strong as our weakest link. So that's why we all have to figure out that blaming someone and saying it's your fault, go to them and say, this happened. Let's figure out the way to keep it from happening again. Ethics. This is what we're going to talk about today. Code of ethics. Everything you need to know to be a good ethical administrator. If you're a good ethical administrator, you're not going to be just a good administrator. You're going to be a great one. So there's been a public outcry for accountability. How many of you have seen the front page of a paper where it talks about somebody died in the nursing home because of neglect? All these people in nursing homes throughout the nation, but then one incident happens and where's the margin for error? When COVID hit, we heard about the thing in Seattle. COVID had just entered the US. Nobody even knew how it was really being transmitted or anything, but they let these people die. Those people, we've seen the people die since then. My father actually died of COVID, and we knew he had very compromised lungs and breathing. We knew that if he ever got COVID, he wouldn't survive it. So that's kind of what happened in Seattle too. Everyone started blaming everything, but no one understood what was going on. We must create a climate of trust. If your residents trust you, if your staff trusts you, and if their families trust you, that's how you're going to succeed in having a great organization. And then we're going to work to change that negative image. Back in 2004, Leading Age Oklahoma changed the way every nursing home is reimbursed. We did have a flat rate. Everybody got paid the same. So there was no incentive to provide more care than the minimum or do anything differently. I won't get into this in depth, but every facility has a facility-specific rate. And believe it or not, some nursing homes are paid $35, almost $40 more than another one. That much of a difference in the per patient per day rate. Why? Because they're staffing more. So here's one of those nuggets. If if you staff up a little bit more, now keep in mind, this is pre-COVID or post-COVID. In COVID now, we can't even get enough staff. So this is outside of COVID. If you staff up a little bit more, you're going to have better care because the direct caregivers are ultimately the single most important determining factor of quality of care. So if you have adequate care, then you're going to have better surveys, you're going to have better quality of life, quality measures. You're going to have a higher census because when you have better surveys, when you have better quality measures, better surveys, you're going to have more referrals. And 40% of your referrals now come from within inside the building. So then you grow your census. Keep in mind, this is outside of COVID. You grow your census. What does that do? It increases your income. And when you increase your income, if you're spending that money on staffing, you have more money to pay the staff. So think about that big circle. Because before we changed this, I used to talk to administrators and we were saying, okay, what happens when census is low? First thing you do, you cut your staffing. And I said, sometimes that, while staffing is the biggest expense you're going to have, cutting staffing or not having adequate staff can result in surveys, efficiencies, fines, poor 5-star rating, poor quality measures, and lack of referrals. So it's just kind of a big circle. And, and there has to be this balance in the circle. I was an administrator. I'm not living in the clouds thinking we just spend more and we make more. And we'll get into the finance of this. There is a delicate balance between your expenses and your staffing. In 2019, we were a part of the largest single rate increase that nursing homes ever got. And that money was put into nursing homes. And finally, we thought, the light at the end of the tunnel, we're finally getting, it was an 18% rate increase. Unfortunately, COVID hit. I mean, that went into effect. And months later, not a year later, we didn't even get to enjoy that for a year. And COVID hit. And COVID has disintegrated any of that money. Because if you're working in an organization, agency staffing is killing us. It is killing us. PPE was killing us. Testing, everything. I'll tell you a little bit about staffing in a pre-COVID environment. There was an individual that got licensed about the same time as me, and he took a job at a nursing home in Missouri, and I took a job at one in Oklahoma. And his nursing home was in bad shape too. Mine was decertified, but his was no staff, no residents. It was dying on the vine. I actually had him come and speak, since I've been at Leading Edge Oklahoma, come and do a presentation on this. Because 2 years after he got there, not only was there a waiting list to get to be a resident at that nursing home, there was a waiting list to get to work at that nursing home. And that is huge. Every year we do a compensation and benefits survey of our member communities. And people will always say, we need more money, we need more money. In any national survey of any industry or profession, pay comes up number 4 or 5 on the scale. They all say they need more money. You know what they really want? They want to be recognized. They want to be valued. They want to be a part of the process. They want their opinion matters. I know in some of our organizations on that survey, there was an organization that they were in the bottom 25% of the amount that they paid in wages. Their turnover in their nursing home pre-COVID, 23%. That's one of the lowest turnovers I've ever heard of. People would leave there and go get a quarter or 50 cents more. They would come back and work there. Why? It was always adequately staffed. They always had the backs of their employees. They always had people on the schedule to help them out. And they felt valued. People would leave there, then they'd come back. They actually had a list. You had to be a PRN for a while to get to be a full-time aide at that nursing home. That would be a dream. And we'll talk about that post-COVID. Can't talk about it now. So the Affordable Care Act that was passed years ago included in it an ethics component, a required compliance element, required compliance personnel, a reporting system whereby employees can report violations without fear of retribution and a mandatory annual training. You know, when I did this presentation several years ago, I had people that they looked at me like, we don't have really that program. So as a little heads up, you need to make sure you have that. Mandatory compliance, section 6102, 6401, and 11281. You have to have a mandatory written compliance program. You have to prevent, detect criminal, civil, and administrative violations, effectively promote quality of care, and it has to contain the minimum required statutory elements, which are implementing written policies and procedures and standards of conduct, designated a compliance officer, an alternate method of reporting anonymously. This is very important, and disciplinary standards that set out consequences for violation. Like if someone violates things, that they will be terminated. You have to have someone to oversee this. You have to have due care not to delegate substantial discretionary authority to those who have had a propensity to engage in a violation. You cannot put the person that has had problems with the trust fund instead of let them be in charge of the trust fund. You have to make sure that you're not delegating responsibility to someone who might have a problem with that, or might, you know, if you put the delegation to a charge nurse, it might be in her best interest not to report something. So you need some checks and balances there. And you have to communicate to staff, contracted service providers, and volunteers as annual training is mandatory. And you have to take steps to achieve compliance by internal monitoring and auditing. I'm going to give you a little hint. In every administrator's offices, because I've seen them, there's binders. It's policies and procedures and a handbook and things like that. When was the last time anyone pulled that out and updated it, even looked at it? And I'm going to tell you, surveyors have pulled those out before. Show me your policy. When was the last time this was updated? What committee do you have that is reviewing this? There's some exposure there. So don't discount that responsibility. You have to have a consistent enforcement of the program, and after detection of a violation, ensure all reasonable steps are taken to respond and then prevent future violations. The last thing you want is to have a problem and have it repeated. You don't want to have surveyors come in and say, oh my gosh, and they cite you for this, and you clear it, and they come back and this problem still exists. Once you've been cleared of a problem, of a deficiency, you celebrate it and you make sure that there's protections in place that it doesn't happen again. And if you have 5 or more facilities, there's actually, you have to have a designated compliance officer and an annual review of the program or revisions. So now you might also know about the requirements of participation. This was the first sweeping change that came to nursing homes since OBRA 87. And I mean, it had a lot to it. We had phase 1, phase 2, and phase 3 was getting implemented. And what happened? COVID hit. So now they're circling back with some of the requirements of participation, phase 3. So you'll be hearing about that. But right now, we've kind of taken a pause on everything in long-term care because COVID is out there. But CMS just issued guidance 2 days ago or 3 days ago that said it doesn't matter if we're in the midst of COVID. You still have a responsibility to adhere to all current regulations. And they called out the state survey agencies. If you as a state survey agency do not cite these violations, we will come in and bring in contracted people, contracted surveyors to survey these facilities and write those federal F-tags. And you don't want that at all. So stay up to date. And I'm going to tell you something. There is no defense in saying, I didn't know about it. You know, so you need to keep up with these things. Whatever resource you have, you need to access that because surveyors aren't very forgiving if you say, that really doesn't apply to me. So compliance and ethics. It requires the operating organization for each facility to have a program that has the written compliance and ethics standards and policies and procedures capable of reducing the prospects of criminal, civil, and administrative violations. And I'm getting now into the code of conduct for ethics. So this is part of it. Commitment. Does the organization participate in a quality improvement or accreditation program? Does the organization have a written code of ethics? If so, how does it guide what the organization does? So here's what I think every single person should ask someone. If you're looking for a job in long-term care and you're being interviewed, the nugget is you need to ask them as many questions as they ask of you. Why? You're putting your license on the line. So I knew an administrator one time, and she had Eden Alternative Training, culture change training. She was a former DON, which would be the best hire in the world for a nursing home administrator position. They know the DON part, and they're qualified to be an administrator. But what happened is she got into this facility and really wanted to make some changes. And the owner said, pulled her back and said, whoa, wait a second. We're not changing anything. And she said, no, there's a better way to do it. We could staff better if we did it this way, or there's culture change initiatives we could implement. And he said, no, we're doing it just like this. 6 weeks into that job, she walked out. That was probably one of the best finds of an administrator you could ever get. But he wasn't willing to work with her on any changes. So when you go to look for a job, it's your license on the wall. You need to know that you're going to have the ability to hire who you need and how bills are going to be paid. And if something happens with the finances, you have a bad month. When I was a nursing home administrator, I had a month where I lost 11 residents, an upper respiratory infection. They called in the health department, did testing, screening, and everything, and it just hit us hard. 11 residents in 1 month. So what happens? And is the owner going to tell you have to cut your staffing by 25% to a critical level? You need to know where they stand on some of those things like that, because you have to work collaboratively. It's not just you, and it's just not them. You work together. So you have to know what the responsibilities are and the commitment. The charge of an administrator: provide the highest quality of appropriate services, adhere to all laws and regulations, take steps to avoid discrimination on the basis of race, color, religion, sex, age, or any protected class under law, and seek counsel from qualified professionals when needed. So what does this mean? You're the administrator. Remember the pack I told you on your back? If you get to the point that there's something you don't know about, you ask the owners. You bring in legal counsel, or you bring in a consultant that can help you, because you don't want to compromise your operations. Governance and accountability. What is the organization's mission, and what policies and procedures do they have to ensure all staff members work according to the same beliefs and goals? So if you get hired by an organization, you have these great aspirations, are you going to be able to carry that out? When I was probably 15, 16, 17 years old, and I kind of, I knew about the nursing home thing because that happened earlier. But something happened. I watched 60 Minutes, and there was a segment on there about nursing homes, and it was Golden Ages Nursing Home in Dallas. It wasn't Golden Ages, that's in Oklahoma. It was Golden something. And it was about this man that had these aspirations to have a good, great nursing home. And it really was. And I listened to that. I thought, oh my gosh, this is possible. It truly is possible. That man went on, as I got into my career with Leading Age, they had the Award of Honor. One person every year gets that Award of Honor for their outstanding lifetime achievement. It was that man that ran that nursing home. It was on the 60 Minutes segment that I had seen years and years before. His name was Herb Shore. The other thing is, who is the owner or board of directors, and what is their role in the operations? So you're either going to have a board of directors to be accountable to in a not-for-profit, or you're going to have an owner. And like I said, you need to make sure you're on the same page with your mission, vision, and values. Innovative care and services. How does the organization identify and adopt new care and service practices? So when culture change came about, a lot of people were saying, well, let's do some neighborhoods, let's kind of make some changes to make this nursing home a little less institutionalized. Are people receptive to that? That's a really a good thing to inspire and encourage your staff. Something to kind of recharge their batteries, to motivate them, to kind of freshen things up. What is an example of an innovative policy or procedure that they have implemented? And do they collaborate with other organizations? So you could ask that of a prospective employer. Actually, if you're working in a nursing home now, say, you know, I'm just wondering, in the past 5 years, what has been our greatest success? What have we implemented that's been a game changer? Now, this would have to be pre-COVID, because COVID, we have a 2-year freeze on everything because of COVID. So what has changed in that facility? Whenever I took over at this decertified facility, I had no idea what I was getting into. That's why I keep telling you all, you need to ask as many questions of them as they do of you. When I started that nursing home, I thought, well, I need to know the residents and I need to know the staff. So I got the charge nurse and I said, I really want you to do a walkthrough with me and introduce me to all the residents, because I have to know who we have here. So she took me through all the rooms, and we got to one room, and I started to open the door. She goes, don't open that door. I said, why? She goes, just don't open the door. I said, is there a resident in there? She goes, oh yeah, but don't open the door. I said, well, if there's a resident in there, I'm responsible for that resident. I opened the door, and there was a man, literally. And keep in mind, we've made great improvements in long-term care. And you know, we look back at what nursing homes used to be, and things are so much better than they used to be. So if anyone says that nursing homes have not progressed, they haven't been in a nursing home. Our nursing homes have really done a good job of moving forward. This man was literally in a Hoyer lift, in a sling hanging above his bed. And he had 2 decubitus ulcers. And I could have put my fingers in my fist in his hips and turned them and never touched flesh. They were 2 gaping holes that big. I said, okay, we've got a problem here. And we transfer him out to the hospital. He died a few days later. But my point is, you have to know what's going on with your residents, and you have to know what's going on with your staff. So the other thing is, this charge nurse, I was new, and she wanted to make sure she made a good impression. She said, I know all the residents. I said, oh, good. And then she proceeded to tell me as we were walking through the hallway, she said, I'm so good, I can pass meds by memory. I said, you can? Really? She goes, yeah, pass them. Do you know how many pills are white and round? Do you know how many pills? She would make up all the medication pills, and she saw them out there, and they weren't labeled. She just made them all up. And she could tell by the pills in them. She could pass them. She knew everyone. She said, I'm good. I know all about that. I said, that's good. And then I said, okay, I need to know about supplies. Where are the gloves? This wasn't in 1966, I'm telling you. This was back in 1991. And they said, oh, there's the gloves. I said, that's 1 box of gloves. And they said, yeah, our owners will only let us use gloves if, and this was the previous, we're getting some new owners in there. The previous owners, we could only use a glove if they had to insert a suppository. That's the only time you could use. The rest of the time you couldn't use a glove because they were too expensive. So that's why it's really important to have a shared mission, vision, and values for your organization. And you know, I'm telling you things that you probably are thinking, why is she telling us this stuff? For one, those crazy things happen. 2, sometimes those crazy things sometimes still happen. And 3, you need to know what kind of could happen. You know, one time there was a 2567 that was, I want to say 454 pages long or 350 some odd. I can't remember, but the one, it had a deficiency in there. The owner was making up the names of employees. This was before you had to report this, making up the names of employees and certification numbers. The employee didn't exist, and that certification number didn't exist at all. There was no nurse aide in the building with those numbers. Moving on, community involvement, really, really important. Don't discount this. A lot of organizations have tremendous community involvement. I work with a lot of not-for-profits, so they have church groups coming in, they have people singing, they have people doing the monthly birthday party. It is a great referral source. Never discount your community involvement. So are volunteers involved in the organization? I knew a big church group that used to go into a nursing home every month. They brought the cake. They brought 10 volunteers. They brought someone to do music. They brought the plates, cups, napkins. They did it all. No one would even get the residents down there. They couldn't even get it organized. And finally, the church said, we're not even going to do this anymore. And they said, why? Well, you won't even help us. You won't even get the people down here. That is why community involvement is very important. You need them. You need them. You want them. So it's very important. So you need to know what kind of community programs are integrated into the facility. At Christmas time, you know, pre-COVID, I should have just put a watermark on all of this. Pre-COVID. I don't even want to talk about COVID. We're not, just pretend everything is stop there. So church groups coming in and singing, you know, high school groups do theatrical performances. Community theater could have done a little thing. That the possibilities are endless. And you know what? Doesn't cost any money. And sometimes it takes one phone call. Could you come in at 7 o'clock and perform? Sure. Tell me what you need and we'll get the people down there. It adds so much to quality of life. You can put in the paper a picture of it and say, gosh, do you know what's going on at that nursing home? Great things are going on. A lot of people have done the cruises with old cars around the nursing home. Some of you might have done that. How awesome was that? I participated in one of those. You got to see all the cars. And it was just like a walk down memory lane for some of those residents to see all those cars and stuff. Are residents encouraged to vote, participate in religious services, and continue other lifelong activities that are important to them? Religious services are so, so important. And that's one of the resident rights. So get some clergy, ministers, whatever in there and offer that. And because it's really important. I had a resident that was in my facility one time and she was crying. And I said, Mary, you know, why are you crying? And she wouldn't say anything. And so I asked the nurse aide, I said, what's wrong with Mary? Every day of her life, from the day she was old enough to read, she read her Bible every day. Once she moved into the nursing home, no one read her Bible to her. First time in her life. And she was dying inside because of that. She probably would have easily given up her bath or any other assistance to have that happen that day. So sometimes think about their quality of life. That's what you're measured on. It's not always the nursing care. It's that activity program. You know, and I'll just jump in real quick about activities. You know, there are activity directors, then there are activity directors. We actually had an activity director that was trained through our Leading Age program. He'd never worked in a nursing home, never had any ties to a nursing home, needed a job, went through activity director training, went back to work at the facility, and he started Googling things and looking at some YouTube videos, and he did this drumming thing where you get a laundry basket, a beach ball, and some kind of sticks. And I can't remember what they used. It wasn't chopsticks. It was something easily, like you could buy at Dollar Tree. Anyway, he had over 1 million views on YouTube for this thing. He was on the Drew Barrymore show, and he was on one of the national news networks, but did a story on him because of this creative thing he did in nursing homes. But how awesome was it that what this little activity got so much exposure? But how sad was it that they're thinking that that stuff doesn't go on in nursing homes every day? There's some really good activities. And I'm going to leave you with this. If you have a great activity going on in your nursing home, get your local newspaper to do something about it. Post a video on Facebook. Let the world know, because sometimes we're our own worst enemy. We're the best kept secret. And if we don't tell our story, who is? We'll go back to the AARP survey. I'd rather die than go to a nursing home. well, look what it did for my grandfather and look what it could do for other people. But we have to let them know the good that's going on, okay? Continuous quality improvement. So that's the other thing. What is the organization doing to move forward? Because here's the thing, there is no status quo. Because if you think you can just do what you've ever done, always done, everybody else is moving forward. The bar is being raised. So if you're not doing something to improve your operations, you are regressing instead of progressing. So here's the big thing, the human resources. Your leadership is critical for the operations of the organization, but your leadership is critical for your staffing. You know, there are some nursing homes in Oklahoma that have a turnover of 200%. So stick with me for a minute. Every nurse aide, the cost of turnover of a nurse aide is $5,000. You turn over 100 of those, $500,000 a year is flying out the window. No benefit, nothing. What if you're an administrator, your owner came to you and said, I'm going to write out a check to you for $5,000 and you could do anything you want with it? Oh my gosh, think what you could do. You could might make some infrastructure improvements. You might give some incentive wages. You might have a little extra staff, hire another activity director person. What could you do with $500,000? That's what's happening in our nursing homes now. And you know, I told you the story about the one with 23% turnover. Think about their finances compared to the one with 200% turnover. I had a facility come to me one time, one of my members, and said, you know, we need you to help us. We got a bad problem here. Pre-COVID, keep in mind, everything's pre-COVID. Their agency staffing was as much as their entire payroll. And I'm like, I got up, I went to their building and I said, okay, I'll help you. But you have to have 2 nurse aides at the table, a CMA, a charge nurse. You need your DO in there. You need to be there. One person doesn't fix the staffing problem. It's everybody. And if you think you can hire an HR person that's going to fix it, save your money. You're not going to fix the problem. It has to be an interdisciplinary approach. So anyway, I sat down with them and they told me this, and I was like, okay, you've got to be kidding me. But I didn't say that. I said, sure, we can work on this. The first thing you have to do is, and I'm sorry if one of you works for a staffing agency, every nursing home has had to rely probably on staffing at this time because it's just the way it is now. Pre-COVID, there were nursing homes that never, ever used agency staffing, ever. They just said, we're not going to. One time when I was an administrator, an individual came in and she said, with broken English, she was like, and I said, are you staffing agency? Me staffing agency. And I was like, you're not coming here. We don't use staffing agency. Go someplace else. And I always said, I'm never going to work short, ever. But I also always said, I'm never going to hire the next warm body that comes in. Well, I lost some staff and things happened. I was like, oh my gosh, I'm at that point now. But fortunately, I had such a good relationship with my staff that I would go to them and say, you know what, so-and-so can't come in. I need you for this staff shift. Would you do it? And sometimes I'd say, if you would do it, I'd give you a half, pay you. You're going to end up with overtime, but I'd say, we really need you now. Give you 4 hours extra off to take off someday, not just work again, but to be with their kids or do something like that. And I was fortunate that I never had to use agency staffing, but sometimes it's just essential. So anyway, I told this organization, you have to eliminate your dependence on agency staffing because you can't afford it right now. But what you have to do is everybody has to pull together. And you've heard stories sometimes that you get some nurse aides that a new nurse aide comes in and she's brand new and she's doing everything perfect and she's hustling around there and she might be making someone else look bad. So sometimes it might be that they might try to run off some of the new staff because it makes them look bad. And I'm putting this in a really politically correct phraseology or whatever. But there has to be a shared mission, vision, and values. I mean, I had a charge nurse that came in that was the best. And she was making that other charge nurse look really bad. Oh, and by the way, that charge nurse that showed me around and told me she could pass meds by memory and she was so proud of herself. As soon as we got through the tour and everything, I said, thank you for all you've done for this organization. If you could just get your things down because we're not going to need you anymore here. She goes, you are going to let me go? I said, yeah. And I let her go. And she said, nobody knows this building but me. I thought, well, we're never going to turn a corner if you're still here. So I let her go, but she was also very mean to another charge nurse that ended up being my go-to charge nurse. She was the best. But if I would have kept that other bad charge nurse, this other one would have left. And so Jim Collins has a book, From Good to Great. How do you move your organization from good to great? First of all, you have to get the right people on the bus. And sometimes I have had to let people go that I'm like, and I was scared. Don't get me wrong. That charge nurse, while she had some faults, she also knew a whole lot. Great relationship with the physicians and the pharmacists and everything. And I was just like terrified. I thought, can we do this without her? I thought, we're not doing it with her. So we're doing this. We got rid of her. So it's a tough, tough road. So I told this organization, I said, we have to eliminate agency staff. You have to bring in your team and say, you know what, you can get some overtime and we're going to pull together. We're going to bring in some good other staff. And so if you have friends and connections with other people, we're going to set a new tone in our staffing model. So we staffed up a little bit. They were agency free in 6 months. Then I'm going to tell you, the overtime was out of control. But after 6 more months, the overtime was actually within control, within an acceptable range. And so 1 year of a concerted effort and lots of hard work, that organization, I think they got to where their turnover was like 3% of their payroll, when their agency staff was 50% of their payroll. And think what that saved them. But the ticket is, your staff need to respect you. They need to respect your vision for the organization, and you have to welcome them. If they have ideas, use them. Have committees. If you need to change stuff, if there's problems, bring them in, ask them their opinion, and let them help drive that change. Because you know what that does? That empowers them. It really does. I have to tell you a real quick story about this nurse. I always said I was never going to hire the next warm body that came in. Well, I was getting down there and I was like critical. I was like, oh my gosh. And I told the DON, I said, next warm body that comes in that's certified gets hired. I don't care who it is. And this guy came in and he was probably 6'8", probably weighed 350 pounds. I know he's a big guy. And he had this gruff voice. He goes, hi, I need an application. And I said, for what? He said, nurse aide. And I was like, oh. I said, are you certified? Yep. How many years of experience? 8. I was like, and I thought, he scared me. And, I thought, what's he going to do to these, So anyway, I hired him. I needed him on my schedule. So anyway, got him on the schedule. And I said, okay, this is your area. You're going to give baths to these people. These are people. And this poor little woman, he came in, she started screaming. And it was, we had to put out fires. It was a mess. Anyway, that was bad. They were judging him. And I thought, this isn't good. So I kind of made sure that he went from this wing to this wing, this, neighborhood, whatever you want to call it. And he took care of the men or whatever. I got so many compliments from the families about Mark. And I was just like, you're talking about the big guy? Yeah. Here's the story of Mark. Mark ended up being my best nurse aide. And he circled back and he took care of that little frail, probably 90-year-old woman. Miss so-and-so, I'm here to give you your bath. Anything special I need to know? How do you like your water temperature? I sat there and watched that and I was like, oh my gosh, she could write the book of the best way to be a nurse aide. And Mark was a nurse aide with me until I left that facility. And I haven't run into him in probably 3 years or so, but I would run into him on occasion. And I said, where are you working now? And he'd tell me, but he was the best nurse aide ever. But he just needed to be appreciated. But he, goes to show you, you just never know. You can't judge a book by the cover because he was the best nurse aide I ever had. And I thought if I wouldn't have been short, I wouldn't have ever hired him. I do have a member community though that pre-COVID, every nurse aide they hired, they had a period of time where they were shadowed and mentored because they needed to know their competencies. And if they were a little lacking in some areas, they had some extra training. What happened at the end of 2 weeks, everybody had been reassessed, retrained, and was ready then to be a full nurse aide. Nobody got to do that until they went through those 2 weeks. So mark that down. At some point, that's a lofty goal that will pay big, big rewards if you know the competencies of your nurse aides. The CEU requirement. I love this. I actually had the chance to meet Maya Angelou twice. She was at a national conference I was at on 2 different occasions. And this is just, it's a quote I just love. We did the best we could with what we knew. And when we knew better, we did better. So you know what? Think about your staff. Do they really know? Did they not do it because they didn't really understand? That's where you work beside them. So now I'm going to tell you a learning experience. So I took over this decertified facility. And there was a family that was a very demanding family that they had extra family members coming in for a special visit. So I told my housekeeper, I said, Mark, be sure to go down to Mrs. So-and-so's room because the family's coming. He goes, I got it. I already got it cleaned. And I said, you did? I said, I was just down there. And he goes, I said, when'd you do it? He goes, I just did it. I said, I was just down there. I said, let's go look at it. I walked in there and I said, see, it's not clean. He said, see, it is clean. You see, his definition of clean was this, and mine is this. And I thought, oh my gosh, you know, what does your house look like? This is not clean. So the next day I come to work and I have my tennis shoes on, some casual pants and a t-shirt or something. And they're all like, what are you doing? And I said, well, I'm going to be a housekeeper. And they were like, really? And I said, yeah, I'm going to work with the housekeepers. And I worked side by side with the housekeepers for 2 or 3 days because I needed to know to share with them what the expectation was, because my expectation was of clean was different than theirs. When we knew better, we did better. So when I was telling them to clean, they thought that was clean. That wasn't my clean. So we did that and had a great outcome. They enjoyed it. We worked side by side, and all of a sudden they're like all about it, cleaning these rooms. And I was like, whew, mark that one off. Well, then the laundry, the washer and dryers were eating the clothes. Nothing was coming out of the laundry, and everybody had other people's clothes. They were actually just distributing clothes, like, you know, some people didn't have family members, you know, and I was just like, we need a process. No time for that. We're too busy, too much laundry. So I come in, this was probably a month or so later. I come in, casual clothes. What are you doing? Working in laundry. I worked in laundry 2 days. We got a system down. We weren't, because my legal pad was being filled up with complaints, line after line. Sweater's missing. A lady got a really pretty sweater for Christmas. There wasn't anything left of it. I don't know if the dryer burned it or it kind of like melted it. I don't know what happened. But anyway, I worked in laundry, and you know what? I was marking things off the list. Everyone was getting their clothes back. Everything was good. Did that housekeeping with maintenance. You know, I will tell you, here's a nugget. I drive up to nursing homes all the time. I drove up to one flower beds. The weeds were 2 feet tall. You know, and I know everyone doesn't have all the money to have landscape people and yard people and everything. But boy, you could get a high school kid out there and say, I'll give you $15, just weed eat all the weeds out. There was a nursing home that I would go to, and every time I went to that nursing home, the front door, never a fingerprint, ever, ever, ever. There was never any trash on the lawn, ever. And when you walked in, it always smelled good. And you know what? Interesting. That facility had zero deficiency surveys year after year after year. And you know what? I honestly think, sure, they had their problems, but I think those surveyors had their mind made up. They drove up, yard was mowed, door was clean, smelled good. That automatically put in their mind, well, this is a good facility. So Anyway, so I did that with all these departments. And so 1 month in in-service, 1 week in in-service, they were like, where are you going to be next? What's next? And I said, well, that's all I'm going to do. And they said, why? I said, because I'm at this level. The only area that I haven't been is like the nursing assistants, and they're up here. They have qualifications I don't have. They're above me. And I said all these things, and I mean, you should have seen these nursing assistants. They sat a little taller, you know, held their head up, because I proceeded to say how important they are, that I couldn't do their job, and that, you know, and it was really a game changer for everyone on that team to have a higher level of respect for everybody else. You know, knowing that everybody has a specialized job, but if we're going to arrive and be a great facility, we all had to pull together. So public trust, at the end of the day, would a facility recommend your facility? At the end of the day, would they do that? That's the litmus test for you, okay? Are families content with your services? How big is your legal pad on the corner of your desk? Are you putting out fires all day long in complaints? So that's the other thing too, because you know what? Once you get this well-oiled machine, those complaints are going to go down, and you're going to have more time to work on improvement of processes and practices and care, instead of just keeping your head above water. And what do the ombudsman and the ombudsman volunteers think of your facility? When they come in, you know, there were people before, it's like, we don't like the ombudsman, you know. And I was like, you know, they should be your best friend, because they can put out a whole lot of fires without the state being involved. They can be your best friend. So trust. You have to build trust with the residents, clients, and families. You know, I told you about the family member that was kind of demanding, and that's putting it mildly. I'm going to tell you, you're going to have your family members that you love, and you have others that they are going to push you to the limit. And so there was a family member that hid a Kleenex underneath the bed to see how often we were sweeping underneath the bed. And so she was being maybe not very nice to some of the staff. So I told her, I said, you know, her name was Mary Ann. I said, you know, Mary Ann, if you have a problem, you need to come to me. I said, you have to treat my staff with respect. I don't allow any of that in this building. No one, if you have a problem, you come to me. You don't ever let someone go off on your staff. You know, I protected my staff, and they knew it. I had their back at all times. Anyway, so she complained, and she goes, well, it's just not what I need. And I said, well, you know what? Then maybe we're not the facility for you. If you're not happy, then maybe you need to move your mother someplace else. Oh, I'm not going to do that. Nobody be as good as you. And I said, well, you've had some problems with us that evidently we can't correct. So, you know, you might need to look at another place. She was like, well, it's not going to be a problem. She left that afternoon. Pizza delivery, 2-liter bottles of pop. She had a big pizza party for everybody. And that was the end of our problems with her. But she needed to know that I was going to protect my staff. And so your staff will really value you for doing that. You have to have trust of your employees. They have to trust you, and you have to trust them. But you know what? You know, those things happen. You know, sometimes theft, it's really, really bad. So I always like to try to offer a recommendation. Some of our member communities have done this. One of them has done it for 15 years. There was, they have a fund. So there was a nurse aide that was going to get her gas cut off. And so if the gas gets cut off, there's a reconnection fee, you pay a deposit, it costs a lot of money. And you don't want them to have to pay that. They can't even pay the $70 bill, much less the $350 deposit, reconnection, and all that kind of stuff. If they go to a payday loan place, they're going to charge 50% interest. That's not going to work either. They told their staff, if you ever have a problem financially with critical things like groceries or your utilities or gas for your car, come to us. It's completely anonymous. There's 3 people on the staff that are on there. They listen to the thing. You sign a thing saying, this, what I've told you is truthful, and I promise to pay it back. In 15 years, they've never had a nurse aide that didn't pay it back. In 15 years. And now other organizations are doing that too. How much sense does it make for them to go through the financial distress And plus, when they've got financial problems going on, it's going to be real hard for them to dedicate 100% of their energy and their mind to their job. So there's things we can do to work with our staff. You have to have trust of the owners and board members that they're going to have your back and you're going to have theirs. The media. Oh, I'm going to tell you, you designate one person that can speak to the media and nobody else. Haven't you seen that on the news? They'll go to a nursing home and they'll see some staff walking away and they'll stop and ask them questions. Every answer they have is a liability. Every single thing they say. It can be misconstrued, taken out of context. It's from the wrong person that might not have known the whole story. You need to have a policy. This is a nugget. Policy in your handbook that no staff can ever meet with the media and ever make a statement. And if they do so, that they would be terminated. Because I will tell you, the legal exposure of that is huge. There have been multi-million-dollar lawsuits because a staff member said the wrong thing. And policymakers. I get legislators that call me all the time and said, you know, a family member called me and said this nursing home. And so have a good relationship with your legislators. And we'll talk about that in the next session. And because that's really, really important. So where to begin? You're probably head spinning. Lead by example. You do the right thing. You take the high road. Lead by example. You have to have commitment. You know, there are nursing homes that I always love this when I call to ask for the administrator, and I've gotten this so many times. Have someone secret shop you when you're the administrator and call and see what happens. I'll call at 10 o'clock, 10:30 and say, is the administrator there? No, she never shows up till about noon. You better call by noon or else she'll be gone. She's only here till about 2. I thought, what if I was the health department? What if I was an attorney? That, you know, you never know who's going to call. So phone skills are real good. But you know what? I said that jokingly. It goes back to the commitment. Do your staff value you? And do you you know, if you care about your administrator, you're not going to throw the administrator under the bus. You're going to say, she's not here right now, or she's unavailable to take the call. Let me take, you know, phone etiquette. You have to know what to do. You have to have buy-in. Remember I told you about the heavy pack on your back? How much easier is this going to be if every one of your department managers said, you have a meeting once a week, these are the problems, we're on top of this, okay, mark it off the list, we've got this. You know, that's how you do it. It's with buy-in. And you have to respect the process. So if there's problems with the process, you go back, you redefine, you pivot. That's really a good word right now, is to pivot. It's really, really hard to do it alone. And keep in mind, while it's an interdisciplinary team, every single nursing home takes on the personality of the leadership. You know, I know a nursing home and the administrator, they tells the staff, call me by my first name. He dresses in casual clothes and he's on that floor. He sees trash, he picks it up, he's working with, if you needed anything, you could go to him and say, hey, could you help me with this? What do you need? What do you need? That's commitment, that's buy-in. Or are you going to be the administrator that's going to sit in the back of the building that might not even know the name of all the staff? You know, one time I took a group of people to a facility that we were going to tour the facility, and the administrator said, I really want to do the tour. I said, okay. So she was touring people through the facility, and we were walking from one area to the next. And as we were walking, she stopped and saw one of the staff, and she said, I noticed you were gone a couple of days because your daughter was sick. Is she all right? Staff member said, she's much better now. We had to take her to the emergency. Oh, that's so glad, so glad. We walked on. And this, I know this administrator real well. She did not do this to impress us because the whole group was out there talking. They weren't paying attention to this, but I was. We were going through there. She sees a true story. She sees another member of the staff. She leaned over to her. She said, I noticed you're down next week for vacation. Hope you enjoy every bit of it. Get some rest. I hope you get to do something fun. The girl said, I'm really looking forward to it. She said, enjoy it. They walked on. You know how that is priceless. Do you know how far that goes to where you even know what's going on in their life, that you care about what's going on in their That's when, if you're working short and you call and say, hey, Sally, you know, we're short, I really need you. Sure, I'll do that for you. And I'm going to tell you, I learned real fast. I couldn't do this job by myself. So I really tried to get a good rapport with all the staff. Not once did I call them and say, you know, I need you, and have them tell me, I'm not going to do it. And I have people say, I've called 6 people. They all tell me no. I had one time said, I don't have transportation. I said, I'll come pick you up. And I did, because we needed her. Not once. You know what? There was a mutual respect there. They respected me and I respected them. So to the world, you may be one person, but to one person, you may be the world. Keep in mind, some of these people in this nursing home, you are their world. You know, you're all they have. So while some people have visitors coming in and out, going, and family members, these other people deserve every bit of that time, attention, and energy and life enrichment that the other ones do too. Because you never know when that one person is going to be, you know, the thing that's going to expose a breakdown of your system, that you know, everyone's needs aren't being met. So finances, you know, when you take the NAB exam, everybody has strengths. You might have strength and you might be a nurse. So you're like quality of care, I've got this. You might be an HR, have been an HR supervisor at another place. I've got that. Maybe you've been a leader of an organization, the top supervisor, whatever. So the leadership's going to be easy for you. Some people have a problem with the finance. There are things you need to know about the finance. Just like what I told you about the cost of nurse aides. So you need to know your break-even point. You need to know your expenses. You need to know budgeting, you know. And I'm going to tell you this, I actually work with NAB and write some of the exam questions. It's really a great process. You need to know some about finances to pass the test, but you also have to know about finances to run your organization. If you don't keep your eye on the ball, I've seen organizations get in trouble because they were so focused on their revenue that they forgot about the expenses. Or all they were doing was working about the expenses, and who was out there trying to work, who was working on the census, know what the break-even point was. So you have to know that. Know what the cost of turnover is. And food costs are through the roof right now. So what happens? What do? Do you cut back on the quality of your food? Find a cheaper place to do it. You cut down on food loss. So that's where your staff really come in. So in their own lives, all of us could say, oh my gosh, you know what I do? And that's where you work collectively to address problems. So responsibility, another part of the code of ethics is responsibility. Residents are entrusted to your care. You must abide by laws and regulations for the profession. You must perform duties with integrity, which will earn the confidence, trust, and respect of the general public. And you must maintain confidentiality for personal health and financial information. So those are all part of the code of ethics, your responsibilities. So now I love this. Ultimately, this is kind of what it's about. What I know I have lived. Every wrinkle tells a gain or loss, a triumph or tragedy. I have not stopped needing or wanting. I will never stop growing or giving. I will not go quietly or gently. I should not be underestimated. I will not be ignored. What you are, I was. What I am, you will be. Remember and anticipate. Assume nothing. Expect anything. Listen, learn, and then we can talk. You might have seen this little picture, some things like this. See this older woman looking in her reflection is this younger woman. I promise you, especially assisted living. There's some of those people, my mom is 88 years old and in assisted living. She goes, I'm just in here with all of these old people. I was just like, well, you know, they don't see themselves that way at all. Please look at my eyes. I am someone's mother or father. I was a teacher, doctor, or skilled laborer, a contractor to society. My life is filled with experiences. I have gained much and given back more. The time has come that I can no longer give. I shall be a receiver. Please don't ignore me. I need your eyes, your hands, and your heart to care for me. I have more to live, wisdom to share. There are lessons to learn. Don't forget me. I need you. Someday you will need. I hope you're not forgotten. I wish every nurse aide had this read to them or could read this or understand it before they ever took their class or they were ever hired at a facility. You know, I had a nurse aide at my facility, and her name was Mary. And every time she needed some assistance, every time someone would go to help her, she would say, go help someone else. She wouldn't let them do anything for her, assist her. And finally, I had to go to her and I said, Mary, you know, you're a resident here just like everybody else. I have a responsibility to you. So we have to care for you. Oh, Mr. So-and-so needs this and Miss So-and-so needs this. And I said, I know, but you need things too. And I walked out of there and I asked one of the staff, I said, why won't she let anyone help her? Mary was a nurse aide there for 42 years. They had a big retirement party for her on Friday. She retired over the weekend, had a spell of illness, and was admitted as a resident on Monday morning. So she knew what the needs were. She knew everybody. You know, sometimes it's hard to get around to everybody. She knew how people had to wait to be helped to the bathroom sometimes, just because sometimes they all need something at the same time. So she knew exactly what they needed. And I just thought, oh my gosh, after 42 years, she is now the receiver. So expectation. The expectation is a part of the code of ethics. You must maintain competencies necessary to effectively perform the responsibilities. And I'm gonna tell you, it's like, oh, I didn't know, didn't quite get that. Shall enhance knowledge and expertise through professional development. There you go with your CEUs. You know, if they say, well, why didn't you turn this in? I didn't know we had to do that. Shall not misrepresent qualifications, education, experience, or affiliations, like you don't make up nurse aide names and certification numbers, or a license. And you shall not perform services other than those you're qualified to perform. And that's a tough one, because sometimes you see someone that needs something and you have to have the qualified individuals to deliver that care. Professionalism, fair resolution to disputes. You have to disclose to the governing body or authority any actual or potential circumstances that could adversely affect the facility. You know, this might mean that you would have to report your own facility, not just an incident, but like an infraction, like something, if something bad happened. And I'm going to tell you, this is part of the ethics, is where you're going to have to decide. You're going to have to make these decisions. And I have a slide in here that's going to help you with that. But you're going to have to make a snap decision. You're going to have to decide something. But I will always tell you, you're going to err on the part of reporting it. Because if you report it, and I had to do this, I reported the facility. I said, oh my gosh, we did this and it was wrong. It was nothing I did, but I had knowledge of it. If you report it, own it, they're going to work with you. If you hide it, change it, then you will have, I promise you, a bigger mountain to climb, and with probably greater repercussions. So, responsibility. You shall not defend, support, or ignore unethical conduct perpetrated by colleagues, peers, or students. You know what? That means anything you see, even if you're saying, oh my gosh, there was a rape that occurred one time in a nursing facility. Oh, well, I can tell you several instances because it's happened. One time there was a man that came with, you know, people used to just walk in nursing homes. They could walk in any room, visit and walk out. Nobody thought anything about that. There was a man that walked in, went into a room, shut the door, raped the woman and left. And no one knew until the next nurse aide that went in to help her what had happened. Those things happen. But if you have knowledge of it, you have to report it. You absolutely have to report it. Because in the past, there have been circumstances where it wasn't reported, multi-million-dollar lawsuits for failure to report an egregious action or event. So it's called the path of least resistance. The other thing is your license. The day you take over that facility is the day you're responsible. That's why I wanted to go around and walk through the building. You need to know who your residents are. You need to know who your staff are. You need to know what's going on, because even if you don't know what's going on, it's your responsibility ultimately. And I don't say that to worry you or for fear at all. You're going to know what's going on. But the other thing too is if you act on it, if you're going to correct it, if you're going to address it. The common initial reaction when an error occurs is to find and blame someone. Well, I told you before, how far does that go? You know what? The best thing in the world is this team approach. When I told you about Jim Collins, you're going to be on this bus moving forward together. So it's everybody together. So is there trust among everybody? Is everyone going to do the right thing? I don't live in the clouds. I know that there's always going to be a few weaker links on your staff or maybe in your management team. But at the end of the day, when there's a deficiency, you're all going to own it. And I hope what you do is when you have a good survey, which I call a good survey, 1 or 5 low-level deficiencies or even 8 low-level deficiencies, if they're low-level deficiencies, then you're going to celebrate it together because that's what you've accomplished together. And you know what? Give a 0 deficiency survey. I've seen them put the administrator's name in lights. You know whose name needs to be in lights? Every single person in that organization. Because you know what? One person didn't do it. It's everybody. So ethical practices, you have to develop it here and educate all staff on the organization's code of ethics. You know, sometimes people struggle for an in-service. Then talk about some ethical situations and what people would do. You know, that's a good learning experience about how that they have to take ownership, they have to report. So put a thing out there. What if this happened? What would we do? And they have to really realize how serious some of these things are. So ethical decision making. This is what you're going to be confronted with. I don't want to say confronted. You're going to be exposed to. Could the decision or situation be damaging to someone or some group? Immediately, something happens, okay, you do the 360. What's the fallout of this? Is the issue about more than what is legal and what is most efficient? So is it beyond all that? How do we know what is morally good or morally bad? So, ethical decision making. I will tell you in this room, a lot of you would pick different paths, different ways to resolve something. So I'm going to throw out a situation. There's an organization that has this amazing activity director, like off the chart. Community outreach, everybody loves her. Everyone knows her. You know, residents love her, staff loves her, and she's put you on the map. You're in the paper, everything's good. And she comes to you and says, you know, I love my job, but I've been offered a whole lot more. So if you don't give me a raise, I'm going to take the other job. What do? No one probably wants to answer. Anyone want? What would you do?
Take ultimatums. You're great at your job, but I mean, it depends on how tactfully you come at it. I mean, also, when was her last raise? I mean, there's a lot of things that come into account, but also someone coming up and giving you an ultimatum is, well, you then take it.
I appreciate that. Thanks for chiming in, because you know what? Most organizations have a policy that everyone's reviewed yearly for a raise. And I'm going to tell you one thing that you can take to the bank. If you think you're going to do something like give someone a raise and it's going to be kept confidential, as soon as that person walks out of that office, there's going to be people that know about it. There's something about how things spread in nursing homes. I don't know. There must be years of walls. I don't know what it is, but microphones are hidden everywhere because. So let me tell you what happened with that. And I use that example a lot. Someone before said, oh my gosh, no, you're not going to lose her. I said, then you know what happens then? You give her that raise. A week later, your maintenance person that has saved you tens of thousands of dollars because he does his job right. And I'm going to tell you, if you have a bad maintenance person, it will cost you, or she will cost you tens of thousands of dollars. You need a good maintenance person. But anyway, then the maintenance person is going to be there and say, well, you know what? Remember what I did? I saved you all this money. I need some money too. And where does it end? So let me tell you what happened with this story. This great activity director was offered a lot more at another job. But keep in mind, not every place is the right environment. I mean, like some people like to work at 7-Eleven and some people say, I'd never work at 7-Eleven. They're mean to them. I'm going to go work over here at Hobby Lobby because they're nice to you. Someone says, I'm not working at Hobby Lobby. I'd rather go over here. We're all different and there's a fit for us all. So, I mean, moving to another organization, is that going to be a better job? Are you going to be happier? And keep in mind, pay is number 4 or 5 on the list of motivation nationally for surveys. So anyway, this activity director did not leave. She turned down the money, and that's been about 8 years ago, and she's still there. And she tells me every time, she said, I love my job. I love my job. And she's very good at it. Okay, so here's different approaches, because when people come up to you, you're going to have to know how to make these ethical decisions. The utilitarian approach, you do what is right or good for most people. So you have to have a backstop, because if you aren't consistent, then you're going to have problems. You need to be consistent, because if you make this decision this time and this one, they're going to know you're all over the board. The rights approach, do what protects the moral rights of those affected. The fairness or justice approach, do what is fair, treat people equally and consistently. And the common good approach, do what contributes to the community as a whole versus individuals, like for the whole facility, not just a group of people. Like if you did, okay, from now on, this group of people, they get this benefit and everyone else doesn't. And the virtue approach, do what is virtuous. Actually, you are the future. Increased standards will elevate the profession. And I know that we are just so tired of hearing about another regulation, another regulation. So this is how we justify it. I remember what nursing homes were like in the 70s. I told you the story about the gloves. So, you know, while we are bombarded with regulations, some of them probably have helped us move from point A to point B, but now we're trying to rethink it. Keep in mind, we work on this at a state and national level all the time. Getting the state and CMS to rethink things. Our national organization just sent 3 letters to CMS in the past, well, since Monday, saying you have to rethink this. This isn't right. When they came out with the vaccine mandate, it was just going to be nursing homes. And they're like, no, you can't do that to nursing homes. All of the staff would leave nursing homes and go to assisted living or home health. So we want to protect the profession, because sometimes there's some weak links, and we bear the reputation, the weakest link. So I'm being politically correct about how sometimes increased standards can elevate the profession. There will be a shortage of administrators for the future, without a doubt. Every one of you in here get your license, you will have choices of jobs. You won't have to look for a job. You'll have choices of jobs, not just because of the current environment, but because of the number of people who are in that age demographic that will be retiring. There will be tremendous growth for long-term care. This profession is booming. Every day in Oklahoma, over 100 people turn 65. You look at the demographics of our elderly population, sure, census is low now. 10 years from now, it's going to be a whole different story. And this is a bright and promising future for committed and ethical administrators. So we make a living by what we get. We make a life by what we give. Keep that in mind. Every day of your life, you're going to give up a day of your life when you go to work. One day of your life, you gave it up. And you know what? If you get up and say, I hate my job, it might not be worth giving up a day of your life for it. But those people that love their job every single day, they always say, if you love your job, you never have to go to work a day in your life because you love what you're doing. And I'm telling you, while this profession has its challenges, it can provide that for you, that fulfillment of knowing that you've made a difference in so many lives, not just of the residents, but of your staff. So unethical practices. I'm going to go through this real quick. These are some of the things, a Title 19 survey that resulted in a 425-page survey report. Do you know how much paper that took? How long it took them to write that up? Obtaining a license by fraud or deceit, conviction of a crime involving narcotics or drug control law, serving as the administrator of more than one facility. And I say that because in the past that happened. Now there are considerations when you can serve as the administrator of a nursing home or an assisted living, or be over a certified assistant administrator. But I'm saying, if you don't have the approval to do that, if you're just hanging your license two places, that's not allowed. And failure to submit federal and state withholding payments. You're thinking, well, that's a given. A nursing home in Oklahoma, there was an administrator, and the budget was a little tight. He didn't want to let the owners know. Started keeping 2 sets of books and just didn't turn in the withholdings. Said, gosh, another 3 weeks, get a few more admissions, and we'll get some more money in, and then I'll turn it in. It got so deep that when they found he left the position, the new one came in and realized something wasn't matching up. They found out what the problem was. The problem was so deep by then that they had to close the facility. They owed so much money to the tax commission. That would not be the way you're going to cut a corner if you don't have money to make budget. You always turn in your withholding, because the penalty and interest literally amounted so much, it shut the building down, and 42 residents lost their home. So indicators of an ethical environment. My supervisor follows high standards of ethical conduct. These are the things that you want the families and the staff to say about you. My supervisor treats me with respect. My supervisor cares for me as a person. I feel comfortable reporting complaints or problems to my supervisor. Management cares for our employees. Values are clearly communicated by management, and I'm given recognition for my job performance. So, I told you some of these slides. This is that slide. You will know that you've arrived when you know that your staff will say that about you. And the reason I said the residents and families, because when this happens, they're the beneficiary. They know you value that staff. They know because of their work ethic. They know because of their practices within the organization that is a good environment. This is a quote that when I came across it when I was in Administrators University, and I call it my quote of the day, and I used to keep it with me. I had one sheet of paper I carried with me for 15 years, and then, maybe 20 years, I still have that same sheet of paper, but I don't use it as much, but I love this. It is the meaning that men attribute to their life. It is their entire system of values that define old age. The reverse applies. By the way in which a society behaves towards its old people, it uncovers the naked and often carefully hidden truths about its real principles and aims. Who are we as a society if we turn our backs on the least among us? That's what I use when I go to advocate for more money for nursing homes. And I'm going to go a minute or two over. I have a few minutes. Core leadership characteristics. This is another slide. Laminate it, keep it with you, read it every day before you go to work. Lead with integrity. Remain close to the environment. Know the facility, the staff, the families, and the residents. Communicate and listen effectively. Address issues, resolve problems with a firm stance. You know why I say that? You get soft. Some people could just run over you. And if you don't have consistency in what you do, you will lose respect as a leader. Admit and learn from mistakes. You know what? There's nothing better that will gain you the respect of your staff than to say, you know what? I made that mistake, and I'm going to own it. We're going to work together to make sure it never happens again, that I don't do it, and the people around me aren't going to be affected by it. Be a proactive manager, not a reactive. Get out there in front of things. If things start going south on something, you can put out a small fire, or you can have a raging five-alarm fire, and you can decide. Sometimes there's an extenuating circumstance that happens that's out of control, but a lot of times these things start small, like the woman who needed the bath. Remember that. And by the way, in the case with that rape, that happened. The administrator contacted law enforcement, reported it all, documented it all. State was called in. And you know what? State told them We're not citing anything. You did everything perfectly correct. You called us, you documented, you called the law enforcement. There was nothing that you could have done that could have prevented that. And there's nothing we are going to do to hold you to it. That's the sign of good leadership. It's when you've covered your bases and something like that happens and nothing's going to happen to your organization because of it, because you did it the right way. And the other thing is empower your staff. And keep in mind, everybody's batteries get run down. We all do. You know, there's the CNA week, there's the activity directors week, the administrative assistants day. You know, and I used to always put those out for all of our members, and I don't do it anymore. Because you know what? Where's the laundry assistants day or whatever? Every day is everyone's day in my book. We celebrate every person on that team each and every day. And you know, you probably ought to be doing something every month to say, and maybe it's a different day, or maybe you're going to do it on one shift one month, one shift the next month, or day of the week, whatever, and just say, we're celebrating that we're doing a great job. You know, there may be problems. There's always going to be problems. But you have to celebrate your successes to continue to move forward. And everyone needs their batteries recharged. They need to be validated that they're working towards improvement, doing a good job, and making a difference. So, any questions for any of you for me? I talk a lot, and I shouldn't. If we answer questions, I'd be happy to answer questions during the break time or whatever, but I want to leave you with one more thing. Every year, Leading Age Oklahoma does an annual conference, and pre-COVID, we would have between 600 and our highest was 698 provider attendees. And then with our exhibitors and stuff, we had over 900 people there. We bring in some of the best and brightest. Full day tracks. Now I sound like a commercial. Full day tracks for nursing, activity directors, social services, dining, housekeeping. We call it environmental services. And it takes a lot to pull that off. We were going to do it in March, but because of everything that's going on now, we decided to wait till July when it's going to be warm and we can celebrate and have a big party. And we're going to have a big party. I always need some volunteers. If anyone would like to volunteer, you can come to the conference for 2 days if you're licensed by them, which I don't think you would be, but you would help with registration at the beginning of the day and verifications, handing out the verifications at the end of the day. And the rest of the 2 days, you can go to the exhibit hall, you can go to all the sessions, you can network with all these providers, you can pass out your resume. The main reason I'd love for you to be there is to learn. If you're going to be a part of this profession and we're doing this big thing, you can come and learn. I usually need 10 volunteers. I have a roster just as a stake in the game, because, you know, when I'd say before, if you want to do it, put your name down, and you don't have a stake in the game, I might show up, I might not, might roll out of bed and think, oh, I'm tired, I'm not going. You would pay $50 and you could come to the conference for 2 days, 2 full days, if you'll volunteer and pay $50. And if you want to do it, that's wonderful. I'd love for you to. And if you're not interested, it's no big deal. But I thought this is a way we have some really great speakers and good education. And if there's a way we can help you be a better administrator, this might help be another tool in your toolbox. So now we're going to take a 15-minute break, come back in here and do a quick wrap up, okay, with advocacy. I'll put this right up here.
Is it usually through the week, Mary?
What?
Is it usually through the week?